Welcome back. It is the Country Viewpoint here on your colour of Country Life, Flow FM. And it's time to take a look at an issue that we haven't really explored so far on this program. It relates to IVF. And joining me on the line now is Gabriela Rosa. She's very well versed in this subject. In fact, she holds a Master of Science in Medicine in Reproductive Health and Human Genetics. And she is joining me on the line from the United States right now. There's a lot to discuss. Gabriela, great to have you on the program. How are you?
Thank you for having me, Alice. I'm fabulous. Thank you for having me.
Before we get into it, Gabriela, just update our listeners with what it is that you're getting up to right now over there in North America.
Yeah, sure. We were having a brief conversation, and I'm doing a doctorate in public health at Harvard at the moment, with a real focus on looking at how fertility patients can get better treatment, better patient outcomes, and really just, get the most out of their fertility treatment journey.
Now, Gabriela, you say it's a big problem that couples face in that there's a lack of attention given to the underlying cause of their infertility, and IVF is not always the answer. So just give us, in layman's terms, the background to this, because it is a fascinating subject and one that you hear a lot more about these days than what you did a decade ago or more. But like we say, IVF, not necessarily the go-to, at least that's what you're saying. So tell us more.
Yeah, look, I think that what is important to realise is that IVF, like many other aspects of healthcare, is an industry. And it's not that there's anything wrong with that. The fact is healthcare systems are designed for getting doing the very least for the highest number of people, right? And what happens is that infertility really is not, if you think about it, the majority of patients, actually the majority of people in the general population conceive almost accidentally. And that's why so many people will say, when they're going through fertility difficulties, whether it's infertility or miscarriage, they'll say, but why is it that I'm going through this problem when I do or seem to do everything that I'm told to do, that's the right thing to do, and I still am having difficulty? And, here I've got my sister, my uncle, my parrot, they don't even need to try and they get pregnant, and there's a lot of stigma around fertility difficulties as well. But the major reason is because, at peak fertility, a couple has an average of 3 months time for pregnancy, and it is true, the majority of patients will conceive without even trying. They'll conceive accidentally, or they will literally stop the pill and conceive the very next cycle. When that doesn't happen, is usually because there are some underlying factors. And there are some issues that are going on that aren't being uncovered. And again, because the healthcare system in most countries, I deal in healthcare systems in the US, in the UK and Australia, because we treat patients literally globally. And so I see all of these different nuances. But the reality is that it's really focused and designed to get the least amount of resources into the system to get the highest output. So a lot of tests and a lot of things that could be done to help uncover the difficulties or the challenges that people are experiencing are left out of the equation because, it's almost like, the medical system deems that as long as you have unblocked fallopian tubes and you're ovulating and you have sperm, you should be able to get pregnant. You should be able to conceive. And when that doesn't happen, it's almost like, the knee-jerk reaction of, well, then just go to IVF. But then when couples ask, but hang on a second, why is it that I need to go to IVF? Is there anything else that I can do? And are told, no, there's nothing you can do. They get disheartened and they just go, well, okay, that's fine. I'll just go and do this next path. And, we know that there was a wonderful paper that was written and published in the Journal of Human Reproduction in 2016 that demonstrated that in order to have a close to 80% live birth rate through IVF, a couple needed, on average, 8 IVF cycles. Now imagine, Alice, one IVF cycle, if you're paying it privately, depending on where you're paying it in the world. In Australia, it's subsidised, and, in some places you're still paying upwards of $10,000 per cycle. Now imagine having to do that 8 times. And if that wasn't enough, when we look at the actual impact on a couple's relationship, on a woman's health, And, the burden that it actually brings to that whole equation is considerable. It's not just a simple matter of injecting yourself every single day with some drugs, and at the end of that time, you will absolutely end up with a baby. It doesn't happen like that for the majority of patients, unfortunately.
All right. Now, Gabriela, I'm really interested in just exploring the IVF line of inquiry a little bit more, because I feel like there's a lot of listeners out there who, like myself included, who just hear about IVF. They don't really ask many questions. They just accept what they're told anecdotally. Why is it that, IVF has become more and more popular and more relied on? You can't argue that it's at the height of its popularity, really. So when it comes to trying to conceive and not being able to conceive, what really are the strongest sort of, indisputable factors behind that? Obviously, age is the one that people sort of bring up the most, but just hearing it from someone who knows best, just unpack for us exactly what those factors are.
Yeah, no, look, I think that's a really great question. And to do that, I'm just going to take one tiny little step back and say that, it's not that IVF is not a good choice. It can be. What is not a good choice or a good kind of option is to go straight into it without understanding the underlying root causes of the problem. Right? And why do I say this? In my clinic, I have been doing this work now for 22 years, and I see patients typically, we kind of are at the end of the line. Patients come to us when they have tried, what they think is everything and nothing has worked. Many of our patients, almost half of them, have experienced failed IVF cycles. And as part of my master's in public health at Harvard, because I completed a degree before with the degree that I'm doing now, we conducted a study to look at exactly, how our program actually impacted these chances, of patients going through infertility. And what we found in a study of 544 patients is that the majority of them had been, on average, infertile for about 4 years. Almost 50% of them had experienced previous failed IVF cycles. And out of our whole patient population, 78.8% of them went on to have healthy babies. And the majority, 47.7%, conceived naturally, right? So we've got to question what else is there that perhaps causing these failed attempts. What else is there that's not actually making IVF work? And we find this often because we have patients who have done multiple cycles that unfortunately failed, go on to embark on a treatment that is holistic and that looks at the entire health picture of both partners experiencing conception problems. Because, fertility is a team sport. So for us to look at a woman who technically is not getting pregnant, there's always a man that is not being able to get that woman pregnant, right? And so it's not that there is any kind of blame game going on. It's really just a matter of, okay, how do we optimize that couple's chance of having a baby? And I think that that's a really important point for couples to take into consideration. It's that it's not one or the other. It's really looking at what are all of the pieces. I often like to talk about the fact that for a woman or a man, when we are wanting to create a healthy baby, we need to utilize both parts of that equation and apply what I like to call act pregnant now to get pregnant later. So absolutely anything that you would do if you were pregnant right now, and I know that, Ellis, for a man it's really difficult to kind of, get your head around being pregnant, but if you imagine that you could be, right? I know that for women this is really, really easy. And if I say to them, imagine what are all the things that you would absolutely start doing or you would stop doing if you were pregnant right now, they would rattle off a list, right? And so the key is to look at, okay, even before you're pregnant, if you're wanting to optimize the chances of you getting pregnant, but also optimize the quality of the egg and the quality of the sperm, which will improve the chances of having a baby irrespective of age, and we've seen this, very categorically in our study, then we need to act pregnant now to get pregnant later. And I think that, when we look at those two factors combined, which is diagnostics, really proper diagnostic treatments, diagnostic tests and looking at what are the underlying causes and then applying effective treatment along with acting pregnant now to get pregnant later, that's when we see for our patients the best result, irrespective of what hasn't worked previously.
All right. Well, Gabriela, we'll finish on the note of your evidence-based program that you founded, the Fertility Breakthrough Program, a 78.8% success rate for couples wanting to have a baby. So just tell us more about this and, where people can find out more about it too.
Yeah, great. So they can go to fertilitybreakthrough.com, and they can also look up on Spotify my book, Fertility Breakthrough, Overcoming Infertility and Recurrent Miscarriage, even when other treatments have failed, is available, for people to listen for free on Spotify if they want to as well.
And Gabriela, I might just take the opportunity to quickly ask you about those who are based in isolated parts of the world. Let's just sort of define our geographic location to Australia for the time being. So talking about the regions, we know that, there's all kinds of issues with a lack of access to healthcare in regional Australia. So obviously it's great that people have online tools and resources such as what you're providing to learn more about your program and to understand better why they shouldn't sort of look to IVF as, the go-to option, if you like. So just sort of, I guess, tell us more about your thoughts on how we can get more education into people in the regions. How can we find the resources and the means to put on more seminars in really isolated parts of the country so that people actually have some awareness about their options?
I think that's such a great, such a wonderful idea. I have been considering actually even doing retreats in different parts as well, so that's actually a great idea. One of the things that I find, with the patients that find us, I guess, we do a lot of online education, and that's a really good option. Now, we started actually treating patients in, literally every continent other than Antarctica, really, in 2003. And so sometimes it's about figuring out what it is that you need. Because, for example, when we're treating a couple in a remote region, what we will always do is we'll actually make connections with medical doctors around that region to really liaise and work together for tests in particular, so that the patient doesn't have to be traveling so much, right, to go and get the right tests. And so it is important to lobby, your local officials. I think that's always a really wonderful thing, because if they understand that there is a need and that there is a strong desire, from the population and from the community, then they're much more likely to allocate resources. Sometimes it is the squeaky wheel that gets oiled, right? And so in terms of raising funds and raising awareness from that perspective, I think that's definitely, an important way of going about it. The other aspect as well is leveraging the online communities that are available and that are around, because that's one really good way. I know that certainly from our patients' point of view, we do provide that as part of our service, as part of our program. So that's something that our patients are very well taken care of with.
Gabriela Rosa, she's the founder and clinical director of the Rosa Institute. It's been a real privilege getting to air your insights and pick your brains on this subject. And we wish you all the best in everything that it is that you're taking on, and hope to see you in Australia again sometime soon. All the best, and thanks for your time, Gabriela.
Absolutely. Thank you for having me once again.